Rudy's a 10-year-old Havanese male neutered dog who presented because of the fact that his primary care vet, Dr. Ian Dreeben, noticed on his dental x-rays that there was an issue associated with the bone around one of his right lower molars in the area of the right lower first molar tooth. Previous radiographs of this area showed some mild changes in the bone, but very mild and not something that looked concerning, but repeat radiographs at Dr. Dreeben showed some changes that warranted a biopsy. And so we went ahead and did a biopsy on Rudy's right lower jaw area. And the only way to get to the area of changes on the radiographs was to actually go ahead and take out that molar and then take some bone out around the molar to get a good sample. And so we did the biopsy, and it came back as a tumor called an odontogenic fibrosarcoma, which is a very rare type of tumor. I've seen probably about maybe 15 cases over the last 15 years. So compared to a run-of-the-mill fibrosarcoma, these odontogenic fibrosarcomas, in my limited experience with them, seems to be that they are less aggressive than a real fibrosarcoma, but they can cause some significant bone destruction and affect function and quality of life. So the diagnosis was checked by a second pathologist, and it came back as a possibility of something also called an ossifying fibroma. So we knew it was an odontogenic tumor of some sort, which is a tumor that's arising from the structures that are necessary for formation of the teeth. And we knew that we had to do something about it to try and prevent it from being a problem in Rudy. And so we went ahead and did what's called a segmental mandibulectomy. You can see on the skull here, these lines indicate the line of cut for removal of that portion of the jaw. And we find that when we do this much removal of a segment of the jaw, invariably there will be some tendency for the jaw to shift over to that side due to the gap. Sometimes dogs will adapt quite well to it, but there's certain things that we wish they could talk and tell us if they had any issues with TMJ issues after a surgery like that, or sometimes it's questionable as to how much function they're going to have post-operatively compared to pre-operatively. And then the other issue that they have when that jaw shifts over to the side where the surgery was done is that it can cause some problems with those big fang teeth on the lower jaw poking into the roof of the mouth. So to avoid that, we did a combination mandibulectomy and a mandibular reconstruction all in one procedure, which was a long procedure, but it was nice that we were able to maintain the normal occlusion and maintain function in Rudy all in one surgery. We did a segmental mandibulectomy, started intraorally and then finished extraorally, and then placed a newer technology called a locking plate on the cortex of the mandible to bridge that gap. And rather than just rely on the plate, we also did what's called a cortical allograft in that area to try and act as a strut in between the two sides of the mandible. And that will hopefully provide an opportunity for real bone to form in that area where the cortical strut is. It's called an allograft, which is basically canine bone that has been processed and treated and sterilized to allow us to use that as a scaffolding for hopefully new bone to fill in that area. So some really neat stuff, and there's probably only a handful of dogs in the whole country who have had this combination of immediate mandibulectomy and immediate repair with mandibular reconstruction. Sometimes you have to choose the cases wisely, and this seemed like a good one that it wasn't very severely affected yet, so we had that opportunity to try and do it all in one shot. Kind of the founding father of this technique is Dr. Randy Boudreau, who's at Tufts University. Randy came down to help me with the case when I was at Penn that involved a dog that had a gunshot wound to its mandible, and we did a combination of this locking plate technology and a product called bone morphogenetic protein to fill that gap. And that worked out really well. That dog went on to do very well long-term functionally. And so I'm always looking out for cases that might benefit from this new technology, but they're not always ones that we can do all in one shot like this, because the main goal of an oncologic surgery is to get clean margins, and you really don't know if you're going to get clean margins until you submit that piece to the pathologist. Luckily, Rudy's tumor came back as clean margins recently, so that was good, but sometimes you have to determine if the chances of getting clean margins are good enough that you can do the reconstruction at the same time, and I think that speaks to the fact that Dr. Drieben was able to identify this at an early stage so that we could do the reconstruction all in one shot. It's a good case to remind us of the importance of regular dental checkups at your primary care vet, because this was just an incidental finding. There really wasn't any swelling of the mandible yet. It was just found on dental radiographs. So Dr. Drieben and his staff should be commended for being able to find this at such a early stage that it didn't cause significant problems yet. And Rudy is 2 weeks post-op right now, so we still have a way to go to know if there's going to be a bony union that forms in that area. But that will be the ideal, because eventually the plate, because of all the forces that the jaw can generate, eventually the plate may fatigue. So it'll be nice to get a nice bony union across that area over time. But only time will tell with that, but we'll keep you posted.